Since Ebola was discovered in the U.S., two healthcare workers who are treating the disease have become infected.
A recent survey shows the majority of nurses nationwide say they aren't sure how to handle a potential case of Ebola.
But at Mayo Clinic Health System in La Crosse, nurses meet daily and talk about the Ebola threat. News 8's Mark McPherson has more.
It's a hot topic of discussion.
Ebola has been a daily news headline recently, and a topic that nurses like Kathy Bryant can't escape.
Hospital, at home, on the MTU. I think we're all very, very aware of it.
And it's no surprise, nurses are on the front line of treating Ebola patients. That's why Mayo Clinic Health System has made it a high priority for their nursing staff.
Daily we have team huddles in our emergency department for staff safety and patient safety, and this comes up almost daily.
The hospital has a standard set of questions they ask each patient who comes in, and a contamination room right near the door and away from patients. They also created a sort of mobile Ebola station.
This is our Ebola virus isolation cart.
With everything a nurse would need to handle a patient.
Assorted gloves, shoe covers, hair covers. Most importantly is going to be the sign stopping others from coming in. It's a lot different. Normally I'm wearing a gown, glove, maybe a face shield and a mask, and now I will be all skin surfaces will be covered. Head to toe. Head to toe.
It has become a very high priority.
Trainer Kelly Dixon helps nurses keep up with all the recent changes sent down by the CDC on how to handle Ebola.
We're taking it very seriously. We want all of our staff to know that we are prepared, even though the likelihood is very low. We are prepared, we have the equipment, we're getting them the training, and we are ready should it face us.
And while they remain ready for Ebola, nurses like Bryant are keeping things in perspective.
I'm much more concerned about the effects of influenza on the majority of my patients than I am the likelihood that we're going to see Ebola here.
In La Crosse, Mark McPherson, News 8.
There are currently 3 confirmed cases of Ebola in the United States.
More than 10,000 people have been infected in West Africa, since March.